That brings us to item number 12, Superintendent's Report. I'll recognize Dr. Milton.
Thank you, Chairman Cates, board members, community, those that are in the room and those that are tuning in virtually. Thank you for your participation. Ms. Gardner said earlier this evening how much she misses Spotlight, and I thought that was interesting that she said that, because I've actually recorded a couple things that if we were to be able to have Spotlight this evening for the reentry report, that I think are of record and should be noted for our community to be aware of. I want to check first to make sure that Barrett's picking up on video and that we have, thank you, the volume in the room and those, the comfort that are participating online as well. The first of two before the reentry report is the PIBA Award. School District 5 has received the South Carolina Public Employee Benefits Award, Partners Award for Public School District for the second consecutive year. PIBA Partners is an annual award program that honors employers that demonstrate a dedication to promoting a physically, emotionally, and financially healthier workplace. The award also recognizes employers who go above setting the bar for workplace well-being programs across the state. Dr. Jakes is joining us online this evening. Ms. Turner is here in the room as a director. Congratulations to the two of them, our entire human resources team, and especially to our benefits specialist, Karen Carmichael, for earning this award for the second consecutive year in a row. Dr. Jakes, congratulations to you and to your entire team for the work of your leadership. Secondly, I would like to celebrate the Ready by 5 Award. School District 5's Ready by 5 Award program has been named a Blue Ribbon Program by the National Office of Parents as Teachers and the State Office of First Steps. In earning this national award, the district has to meet 20 essential criteria for its data collection. School District 5's Ready by 5 program helps children birth to age 5 to be ready for school through home visits, community activities, screenings, and other resources. Dr. Harris, our Chief of Planning and Administration, congratulations to you, to Jennifer Felkel and her team for their entire work with our Ready by 5 efforts. Congratulations, Dr. Harris and Ms. Felkel. If we could pause just for a moment of applause for these two prestigious awards earned by our staff. And next this evening we have a presentation. I'll wait for it to be pulled up so that it can be viewed by all board members to be able to see a copy of this electronically. This is our Reentry Plan Part 3. Thank you, Ms. Price. This is going to be a unified presentation of many of our reentry team members that have a role in their responsibilities to contribute to our success for this preparation. I'm doing my end of the year meetings with our principals, and one of them said, I think it well last week, if not best, and the quoted phrase that I would like to use is, the resiliency I see is simply inspiring. So I would pause to say the resiliency of our staff, our students, our community, certainly is inspiring, and I would echo the words of that principal. On July the 30th, School District 5's plan for reentry was approved by the State Department of Education and Superintendent Spearman. I was able to forward her memo of approval to our School Board of Trustees so that they could have a chance to preview it. So this evening we have for you a report to update you. Some of this information is consistent with information that we've shared before. Other is new content, highlighting our work and also predicting to you or showing to you by forecast what will be coming next. This slide is one that you've seen several times before, outlining 5 principles of the work that is guiding our decision making. The first principle in the lower left focuses upon our options that we're offering to families. Principle 2, towards the center on your left, focuses on the safety and the social and emotional well-being of students and also staff. Then on the right side of the slide, you see Principle 3, which focuses upon our student achievement, both current and also long-term. And then Principle 4, you heard Mr. Richardson reference earlier, my 5 priorities. This is also aligned with those. And then Principle 5 is the flexibility and how this is going to be an ever-changing, dynamic situation throughout the academic year of 2020-2021. At this portion of the agenda, we're going to provide for you a variety of updates from a variety of departments. Our first presenter this evening is our Director of Accountability, Mr. Van Holden.
Thank you very much, Dr. Milton. The first thing we're going to be talking about tonight are the results of our Parent and Guardian Reentry Survey. That is a survey that was distributed July 24th to our parents and guardians in our school district, and we worked over the course of the ensuing period through August 5th to collect as many survey results as we could. We sent out 17,032 surveys, and as of the time this information was submitted for the board packet, we had received 80% of our responses from 80% of our parents. Now that was, of course, as of 2:30 p.m. on August 5th. The survey did not close until 11:59 p.m. that night, and at that time that was 13,700 responses. As of 2:30 p.m. on August 5th, about 65.1% of our parents and guardians had selected in-person instruction for their children, and that's 8,916. And we also had 32.4% select 5. That equates to 4,437 students. Our schools and administrators and support staff worked diligently over those few days there to try and reach out to any parents who had not already responded. We were able to continue to increase the response rate through that evening, and so the final numbers are a little different than what's in the board packet for you, but that's the information that we had as of the time that the information was being compiled for you. This time I'm going to turn it over to Dr. Jakes to discuss the human resources information.
Thank you, Mr. Holden. Similarly, we sent a communication to all of our employees across the district. So we did distribute this on July 29th to 2,576 employees. We received 620 responses as of the August 5th date that Mr. Holden referenced earlier. Out of those responses, 64% roughly responded that they had no preference in terms of a virtual work assignment or an in-person assignment. 13.9% of those respondents do prefer a work option, but are certainly able to work in person. 7.9% have documentation of a CDC high-risk concern for themselves personally and are only able to work virtually, while 6.5% of those respondents prefer a virtual option due to COVID-19 related childcare concerns. We did have 3.9% of respondents who have do request a virtual option based on their job not qualifying for virtual options, but are interested in submitting a request for an accommodation. So we would work individually with those employees to meet that need. And 3.7% of respondents have documentation of a CDC high-risk concern for a family member whom they're caring for, and for that reason, request a virtual assignment. I'd like to tell you next about our reentry updates for the Office of Human Resources, and these are continued efforts in each circumstance. We are continuing to ensure compliance with the Families First Corona Response Act, and that does allow for 40 hours of medical leave or childcare-related leave for COVID concerns. We are continuing to work with our employees on CDC high-risk concerns, looking at their medical documentation and how that may qualify them for an accommodation. We're also continuing to provide very clear communication with a focus on safety and well-being for our employees. And then finally, we're continuing to update our resources and frequently asked questions concerning COVID-19 on our HR website so that employees can have access to up-to-date information.
Our next slide this evening is one that you all have seen before of our reentry website. So just to recap as a reminder so that our families and community can have access to this, if you look at our school reentry, we have the address for you here to include sampling to your right of what it looks like, of what our communications team has created for us. So our full reentry plan, documents for families, and also our FAQ. with the reminder of our reentry address so that questions can be sent in, and then internally we can route it to the right people with the right information to assist those with questions, whether they are employees or whether they're families. The next slide is another that you've seen before. Our communications team has taken a sample as to the many questions that we've received to show you how we've taken the question and tried to develop content that is family-friendly and also supportive of the questions and the needs that our families have identified so that they can get properly prepared for the coming academic year. And the next, we have some new content for you to see so that people can actually find where's this information housed. We know that websites can sometimes be intimidating and overwhelming, so we want to make it as simple as possible of how to find information regarding our frequently asked questions. So we've got some step-by-step instructions for you to see with highlights of where to scroll. I'd also like to draw attention to the bottom right-hand corner. You see an exclamation point in a red circle. Again, our communications team has put in some you have to get beyond the statement to make sure that you see content. So they have been intentional to make sure that that question or that statement, as soon as you log into the website, is visible. You read the statement, then click beyond it to get past it. But then once you actually get into the content of our site, you see that the symbol in the right-hand corner is there to remind families or those that are visiting our sites to link back onto that to have the information that we feel is important to catch their attention. The next portion this evening is going to be led by our Chief of Instruction, Mr. Giuliano.
Thank you, Dr. Milton. What we have here is our website launch for 5, which was launched on July 29th, and 5, as a reminder, is our flexible, innovative virtual education, which is our 100% virtual program in School District 5. If you go to our website and look for the Reentry tab, you'll see new 5 virtual program highlighted there in red. You can click on that to take you to our 5 website. And I'm just going to go through and highlight a few key features of the site. So a few of our components. You'll see 5 for K through 8 and 5 for 9th through 12th. So it has grade-specific content if you click on either of those, and I'll show a link in a minute. We also have our course catalog, supply list, and special services for 5, information in those tabs. And one thing that I do want to mention is this is a work in progress. We're going to continue to add information over time. What we have now is the information that's most pertinent to families as they make their decisions. And we have a link to our FAQ, which is based upon our homepage that Dr. Milton mentioned a few minutes ago. That FAQ here is based upon answers related to 5 programming. So taking a look at the site, if you click on what is 5 for kindergarten through 8th, you'll notice that we have information that's specific to kindergarten through 8th. The handbook is something that we're working on for students that enroll in 5, so they'll have that before they enroll. And then we have a sampling of our typical day for an elementary student, which also has a supply list, and course listings for kindergarten through 5th. Scrolling down, you'll notice for intermediate and middle school, we also have the same listed on that page, a bell schedule for each of those grade levels, and supply lists and course catalog as well. Of course, for assessments that require face-to-face attendance, we have a listing of possible assessments that students may have to take that may be face-to-face that meet certain criteria and requirements through the state of South Carolina. So that highlights our 5 website, and at this time I'm going to turn it over to Dr. Harris.
So as we implement the hybrid plan, I'll go ahead and put all this on here, the hybrid plan for the 2021 school year, there are safety procedures and protocols that we would continue to follow, and we will follow. Those safety procedures and protocols have been outlined throughout this, all 3 facets of the reentry plan that we have presented on the various dates, and obviously they include things such as cleaning of our facilities, as well as inclusive of hand hygiene, which inclusive of use of sanitizers and washing hands, and et cetera. This hybrid plan, one of the benefits of it as well is that it also limits the number of students on campus. So therefore, it allows and gives us great assurance that we can socially distance our students while they are in school and in our classes. And then thirdly, we also indicated throughout the plan and maintained that School District 5 will require the use of face coverings for students and staff. Now, the district will provide face coverings for its staff and will provide face coverings for those students who cannot provide their own. These face coverings for both students and staff have to be worn throughout while entering, exiting, and moving throughout the building. And anytime there are larger congregations or congregants of interactions inside or outside the classroom, there is opportunity when social distance is applied that students, while in the class and while they are seated, can remove their face mask while in class, while social distance is applied. We believe this is a way in which face masks obviously can reduce the spread of the COVID-19 virus here throughout School District 5. With that being in mind, we're going to turn the next portion over to our Director of Technology, Ms. Jenny Garris.
Thank you. So a couple things we'll update you on tonight. One is devices. These have been updated since our last meeting so that you are aware. At the last meeting we talked about, we knew we had devices to cover second grade on up. Since that time, we now have secured devices for 5K on up. Our first grade devices will be Chromebooks, and so they'll have those for the beginning of the year. We have had to purchase Chromebooks for our kindergartners. Couple things there. One, being the age, instruction worked with us and we decided a touch option would be really nice, and the keyboard also helps them meet some of the standards that are computer science standards now, even in kindergarten. So those have been ordered and we expect to have those the first to mid part of September. So we've communicated that to our families as well, and so that'll be good timing for our kindergarten students. The exception to that would be our students that are in the 5 program. We will ensure that those kindergarten students that are in the all-virtual program will have a device to start the year. And then once the touch devices come in, we'll swap those out so they have what the other kindergartners have. Hotspots have come up several times, so I do want to update you on that. We've been getting things pretty regularly from the state. And so there are 3 qualifications that qualify a household for a hotspot. The first one is that they have a student enrolled in school. Seems obvious. They also have to currently have no internet service and their income level at the 250% below poverty level. Now, what we did when we had the survey that went out to families, one of the questions on there asked about internet access. And so we had great results, which we were expecting, but we really needed that data to confirm what we saw in the spring, which was very little issue with internet access from our families. And so we wondered, was that because we didn't hear from people or did we have good coverage? And so overall, 98.1% of our parents that responded to the survey indicated that they had reliable internet service for academic work. And notice how we asked the question, because we wanted to say not just do you have internet, yes or no, because sometimes we have internet and it's not great for several kids or for doing the quantity of work they need to do. So we tried to ask the question to really get a good, solid answer. So of those 2.1% that said no, they did not, then they qualify for, they probably qualify as far as number 2. So what we're doing to follow up with those families, and it will go out in the next day or 2, we have a follow-up to those who indicated they did not have internet service to find out if they qualify for under these 3 criteria. And so as they are contacted, they'll let us know. We have not received those hotspots yet. We placed our order. We expect to get those within this week or next week. So there's some, obviously, things behind the scenes, and we'll have those ready to go the first 2 weeks of September, which is the leap days, where many of the students hopefully will come, and then that first week of school. So we'll be able to check that hotspot out to qualifying households, and so they'll have that to begin the year. I did note up here that the hotspots are being provided from the state through Act 142. They are providing internet service on those hotspots through December 30th of 2020. So at the end of that time, or as we get closer to that time, as we all know, things are up in the air, and it could be extended if things are not different than they are now. But right now, that's the plan and what the funding goes through. I will like to add, and it's not on this slide because it's been sort of an update since this even, one of the things that our department has been doing is reaching out to businesses and people throughout the community that have businesses that offer Wi-Fi to see if those businesses would be open to our students maybe coming in, because even if you have internet access, you might lose it at your house for random reasons, and sometimes you can't control that. Or, you know, maybe there's a older student and the younger students are using a lot of the internet and they can drive, so they could go somewhere else. And there's other different things that could come up where maybe the home internet isn't really what they need at that time or isn't working. So I'm happy to say that Columbiana Mall and Corporate Publix has agreed that our students can come and utilize their free Wi-Fi. And we have a list. I'm going to name those two because we have confirmed, and we're going to keep updating our website with those locations, and we'll advertise that so our students know and our parents know. And no, it's not the most convenient to go somewhere else, but sometimes that's what you need to do. And so we want our families to know there are places available for that, for them to have that access as well. We're also adding outdoor access points at 3 of our high schools, so we're strategically throughout the district with some outdoor Wi-Fi. So if a student, and especially the older students, are very good at, they could drive up, they could download some things, or they could work from their car in the parking lot. Again, not optimal, but sometimes in an emergency, you do what you have to do. Okay. All right, so back to, I guess we kind of talk about Chromebooks again, and I said this before about devices. The bandwidth increase also, when we pay for our internet service, there's a cost share. So part of it's paid for by the state through E-rate funds. The other part is paid through the cost share of the district. And so we've been granted a temporary bandwidth increase. And you have to typically, to get an increase, you have to show that you're using all what you have and that you need more. But the state is providing to all districts that increase temporarily because they know what we're all dealing with, and really it's the unknown of what kind of bandwidth do we need for the start of school. So they've increased the bandwidth. We just turned all that paperwork in today, and so we're happy about that. We're hoping that's enough, and if we are using all that, they'll up it more. At this point, it's very hard for us to tell what that need is going to look like. So being proactive and getting that increase now, I think, is a benefit to us. And also, they have told us that hopefully when the day comes and things go back to more normal, if there is going to be such a thing, we can reduce that, which would then reduce our cost share that we're paying. Okay, I'm going to turn it over to Mr. Giuliano.
So we can see here on this slide, we have our hybrid plan, which we mentioned at our last board meeting, and this breaks it down by grade level. So our pre-K students, which are our 4-year-olds, will have a class size limit of 20 students, which means 10 students or less will attend school each day. Our 4K students will attend half-day programs 4 days a week, and then the 5th day, their teachers will be checking in with them remotely. They will not be receiving instruction on that 5th day. It'll be 4 days of full instruction with teacher check-in on the 5th day. For our kindergarten through 5th grade, half of the homeroom classes within a school will participate in face-to-face instruction 2 days per week and participate in distance learning 3 days per week. So they'll stay with that particular class all week and that teacher as well. The other half of the homeroom classes would then schedule on the opposite days. So for example, there's an example that's listed there. If a school has 4 second grade homeroom classes, 2 classes would attend Monday and Tuesday face-to-face, and the other 2 classes would attend face-to-face Thursday and Friday. And then 6 through 12 for our hybrid model, students are assigned to one of 2 cohorts by last name. The results of the reentry survey for parents and guardians are being used to determine how that students will be assigned to those cohorts. And that information will be shared the week of August 10th. I'm going to now turn it over to Ms. Goggins for the next portion.
Thank you, Mr. Giuliano. Communication is always important. It was important before the pandemic. It certainly was important during the closure, and it continues to be important for sharing information with our parents as we prepare for reentry this school year. Tonight, we wanted to share a few of the communications efforts we've made thus far, and show some data and analytics that provide an overview of how our families and community have responded to those communications efforts. And finally, take a look at some of the efforts that are underway and forthcoming in terms of communications. So here are a few of the things that we've already done. Dr. Milton mentioned the website. We, of course, launched that earlier this summer using the address lexridge5.org/reentry. We had ongoing messages to our parents through our automated system, sending emails and texts to provide parents with direct communications regarding updates and to share pertinent information as they became available. We also shared our reentry plan with parents and shared the update from our July 23rd board meeting. Our schools are also communicating with families directly, adding to the information that the district has shared. We mentioned our FAQ page, and that's probably one of the most frequently visited pages and links on our site. We'll talk a little bit more, a little further in the presentation about how we are making that more user-friendly for our parents and visitors. We fielded thousands of questions in our reentry@lexridge5.org email address. As of 5 p.m. today, we had responded to more than 1,150 emails from parents, the average email having between 4 and 6 questions and one as many as 13. We continue to receive and respond to these emails at the email address and will continue for the next couple of weeks. For surveys, we had a dedicated email address for that as well. And then social media. We are both fielding questions on our social media site and posting information for our parents and community members there. These next few slides show our analytics. This is analytics from our website that shows the views that we've had on our reentry page. If you view the first dot there at the center, near center of the page, 11,963 people viewed the page between May and June 30th, and 27,166 people viewed the page between June and July, for a total of more than 52,000 views as of last week. Our social media sites are also growing, surpassing projections for the year. We've also seen some positive returns on engagement and likes to our social media sites, as parents are online with the rest of us to get information about the school year and response to the pandemic in general. You can see where our numbers were in the years prior compared to where they are right now. We mentioned our webpage, and Dr. Milton did earlier, and we wanted to show you that we place information prominently on the webpage. This is a pop-up that appeared on the district page, and it also appeared on our school pages. We also had at least 3 points of entry to information about reentry on the home page. When individuals click the reentry link, they're taken here to the page where they can further tailor the information that they are seeking. We've, of course, mentioned the FAQ. We want to just note here that that is updated frequently, and we continue to revamp and refine the FAQ. It used to be a single PDF that looked like that, and we've created now subsections to make it easier for parents to find information. We will include more hyperlinks in those subsections this week to make it even easier to get to information on our website so that parents can find that information. In terms of next steps, we've already spoken about redesigning our FAQ. That will continue. We've said before of the power of video in communications, and we are working on a host of projects related to videos. We will also be looking at our school communications as well. The schools will continue to send information out about that, and also some information about transportation that's upcoming. In terms of additional efforts, we wanted to let you know that, of course, we were tapping into resources and partnerships with groups like the Department of Education, which has shared some resources and templates, some visual aids. And school districts across the country are talking, and we're sharing information through associations like the National School Public Relations Association, which has been hosting some webinars that we've listened into, some white papers and other reports and other tools for member districts. So improving the quality of communication is a priority. In fact, it's a superintendent priority each year. And our commitment is that we will continue to work to share information and find better ways to keep our families, staff, and community members informed. And with that, I will turn it back over to Dr. Milton.
Thank you, Ms. Goggins. Chairman Cates and board member in the community, for you to see, this is just a holistic overview of the work since the last board meeting. But a couple of points in closing before we open up to questions, Mr. Cates, would be this staff, this reentry team that you see represented this evening, but the district office staff to my right, they continue to collect information, to organize data, to submit it to our State Department of Education. We are in compliance, and we have sought approval because there are processes, whether it's funds or reports that we have to submit to the State Department. We are in compliance, and our plans that we have submitted have been approved, whether it's funding sources or whether it's our operational plan. I'd like to pause this evening to thank our school-level teams, our registrars, our admin assistants, our administrative teams, our principals. They continue to work with a focus of our mission and with our vision in mind. Our team is collaborative, and hopefully you can see through this report this evening, we are making progress. Although we have not completed our planning process, we are in a place that we continue to see that we're making traction, but just as we make traction, new information emerges, and sometimes we have to go back and revisit and revise so that we can have most up-to-date information to be in compliance. Mr. Cates, that completes my report this evening. I'll open it up for any questions that you would like to have.
Thank you. Are there questions for Dr. Milton? Ms. Hammond.
Mr. Cates, I have some questions that are teacher-oriented for Dr. Milton and some that are from parents concerning students. Would you like me to divide them up so that, or can you would rather me ask them all together?
But I would ask that you ask a single question, and I'll recognize another board member. I'll come back to you.
Sure. Thank you. One of the questions that was given to me in concern for teachers, is there a new virtual certification compliance that teachers have a certain amount of time to finish? And I think it's for all the teachers, but I would like you to explain that in the sense that what I got, and maybe because I'm a teacher, Dr. Milton, I know you can appreciate this because you have that teacher heart. It's not any teacher that minds getting this certification, but they're very stressed. This is new. They have a lot of things on their plate in a different way to be sure kids are learning. And I got really upset for some telling me, you know, I'm not even sleeping at night. I'm just not I'm not a computer brain. Even young people sometimes are not real hep on all the ins and outs of computer. And so I just wanted you to maybe talk about that, or if there was any chance, rather than teachers having a pertinent deadline, that maybe they could have longer to get the certification. Not that we don't need it, but could we try and give some leeway to teachers?
Yes, ma'am. Thank you for the question. I'm going to engage Dr. Jakes, our Chief of Human Resources, to respond to that, Ms. Hammond. I can share with you that Dr. Jakes and her team continue to participate with our SCAS Administrative Roundtable, and our State Department of Education continues to be focused upon implementation rather than additional burdens and obstacles. So, Dr. Jakes, if you would offer to Ms. Hammond and to the board a response to that question and how things may have changed for now versus how they were.
Sure. So there is a particular endorsement that educators can receive for online education, and that is an optional endorsement at this time. But certainly during the COVID-related concerns, there is not a requirement to have that. We have checked and double-checked that with the Director of Certification for the State Department of Education, and we have confirmed that that is not going to be a concern for our teachers at this time.
Thank you so much.
And before I recognize another board member, I will just remind my fellow board members that we do have a very full agenda tonight. If you can be very concise with your questions. I do not intend to limit questions or the time we spend. It's important, but just a reminder of our agenda. I believe, Mr. Lovelace, you had your hand.
Yeah. Dr. Milton, you have to back up a little bit for me because this is, 5 is a program and not a school. Okay, so therefore, 5 doesn't have a principal it works through the principals in the existing schools. Okay, so if there's a problem with something where a child is not, just not getting it or whatever, they go through the same situation that they would go to their guidance counselor and to their principal at their existing school.
Mr. Lovis, you've given a great scenario, and I'd like for Mr. Giuliano to come to the microphone. It is our intent to make sure that students stay in the environment where they're comfortable and where they know the names of contacts and the operations of the school to keep them attached to that school culture. So just what you've described is appropriate. Mr. Giuliano, answer a response to that, how we're planning to assign people to be that outreach, that if there is a problem, what parents would do.
So, Mr. Lovelace and board members, each school has identified a school administrator that would oversee the 5 program that could offer support and assistance for students within 5. So each school will have that point of contact. But at the same time, our 5 students also have access to their school counselors and other resources as well throughout their home school, so they can utilize those resources. But there is a school administrator that is assigned as a point of contact per school.
And that will be part of the communication plans once students get settled into the rhythm of the model which they chose, that families would know which administrator to reach out with on staff at that school that they're assigned to attend.
I had a follow-up question, and I'll just real quick. One of the parents came to me and said that the course catalog for the elective courses was not very flush at one school, but it was at another school. And they wanted to know, since the other school, which this happened to be in the high school, but since the other school had offered the course, why couldn't their student at the second high school attend the elective course at the one where there were plenty of course offerings? And did they have to, in fact, not go to the second school, but enroll in a school of choice, in a high school of choice, away from their home school? And that was the question they were asking.
First, that may be a specific question that we may not be prepared to answer with that kind of response, because I'm not sure the school, and to protect the outreach that you had, that may be something I'd ask Mr. Giuliano to follow up. But Mr. Giuliano, talk more about the process of the course catalog and the development. Once we did create 5, there's a process for everyone to know that courses go through the approval to include content coordinators that have been the request of the school to create the course catalog for a typical year of operation. And then we added this year 5 on top of that. So talk a little bit about the consistency and the development of what that course catalog, how that originated, and how we're implementing that process.
Absolutely. So with the course catalog, there are some different offerings per schools, but at the same time, we have school counselors that are reaching out to each student to try to fulfill their needs as best as possible. We cannot fulfill every course request within 5 due to staffing and due to other considerations about the number of students that are enrolling in the courses. But what we're encouraging families to do is the school counselor is actually going to reach out to every student in 5 and have a conversation about scheduling so they can set up that schedule that is ideal for them, that most meets their needs. They can also work in some other courses through SC Virtual and through our Apex program in 5 when they're available to be able to offer those courses as well. So school counselors are going to play a pivotal role with working with the 5 students to create that course for that child.
All right, thank you. Mr. Gant.
Thank you, Mr. Cates. And I want to ask Dr. Milton, going back to the hybrid plan for the start of the school year, in the K through 5 model, would you help me understand? It looks to me the wording in K through 5 and 6 through 12 is slightly different, but it sounds to me like the only reduction in class size in K through 5 would be those students that have chosen virtual education. Sounds like the rest of the class of the homeroom would be there for 2 days, the 2 days if they are scheduled. So, and I know our number is going to vary. You gave a number a while ago of about 65% had chosen person to person. So I want to make sure I'm understanding it right. It sounds like those classes will be the size of the class, less the students that have chosen the virtual education. Would you explain that piece of the K through 5 hybrid model?
Yes,
Thank
sir.
you.
It may help we pull that slide back up. Ms. Price and Mr. Giuliano, if you'd come back to the microphone. Ms. Price, if you'd advance to slide 21, please, of the presentation. We hoped when we created this content that having a side-by-side visual would help families and the community see a direct definition to a line, so that if you're looking for a summary, we would hope that this would be a great way that we could summarize a lot of complicated information to a one concise slide. Mr. Giuliano, could you answer the question for Mr. Gant?
Absolutely. So in the elementary model, typically students stay within a class all day in a traditional setting. They may go to related areas. They may certainly go to lunch and to recess as well. In high school, they're switching classes, or 6 through 12, they're switching classes on a regular basis. So the difference in the hybrid model for kindergarten through 5th grade is because students stay in that one class, they're staying with that teacher and that group of students. So we have related areas teachers that are traveling to those classes versus our students traveling in hallways, versus our students being at recess time and lunchtime in large groups. So you're not minimizing the number of students in class minus the students that go to 5. There is a class reduction size, but what you're doing is you're actually minimizing the number of students in the building at a time, and you're helping with contact tracing because you're keeping students together the entire day in that one group, that one environment, with that one class. So it helps a lot with contact tracing and keeping students together in that elementary model. We cannot do that in the 6th through 12th grade model simply because they change so many classes throughout the day, and to make sure we honor the request and keeping the classes that our students want to take. You cannot have the same model between a 6 through 12 environment and the kindergarten through 5th grade environment. But that's the difference. I can explain further if need be, but that's really the difference between the kindergarten through 5th and 6th through 12th grade model. You're still minimizing the students in the school in both models. It's just a change in how many per class.
Thank you.
Thank you, Dr. Melton and Mr. Giuliano. I realize the difference in the two plans, and I understand the K through 5 plan much better now, but I was thinking of a reduction in numbers in the actual classroom, and I think a lot of other parents have thought that too, but thank you for the clarification.
Thank you. Mr. White.
Sort of follow on that question, because I have heard a lot of questions from parents in terms of why is a hybrid, what does it do to make it a safer environment if you have the same number of kids in the classroom? But, I mean, tell me if this is correct, but I'm just sort of surmising that you're going to have social distancing within the classrooms, within CDC guidelines, whether that's 6 feet, et cetera, and then the hallways and the other common areas won't have the traffic. And I guess the best example is what we saw on TV in Georgia, where a student put a clip of completely crowded hallways. So if you have half the number of kids in the schools, even though they have a full class size, if you're able to social distance that class size, is the advantage that you get to have more control over student flow in common areas, and then you also have that day in the middle to clean. Is that the principal advantage of this hybrid approach?
Yes, sir. That's, I think, a great summary of how that would be. You heard Dr. Harris talk about earlier with the safety protocols for those that participate with hybrid, the face mask or coverings, and then the class changes. We've still got to work through those details and how that traffic is going to flow. We know that our secondary students are social by nature, and we know that education is built on a social environment. So whether you're in 1st grade or whether you're in 11th grade, we've got to make sure that we use that environment and offer the protections that we need for our students and also for our staff. So yes, sir, I think that would be an accurate summary.
And if I may, another question, because this one just comes up repeatedly, and when I go look at the guidelines, I haven't found an answer yet, but what happens if there's a confirmed case in a classroom of a student or a teacher? I mean, what, rather than just saying, okay, here's the CDC guidelines, what are y'all actually intending to do? What's the process?
Unfortunately, it's already happened. We, of course, have athletics in action, and we have operations that resumed where our staff was brought back, our custodians, our nutrition, our transportation. We've had people working throughout the closure in a different level of engagement during the summer. Dr. Jakes, I'm going to call upon you, and I also asked Dr. Harris he would like to contribute from his role, because Dr. Jakes has the side of human resources, then Dr. Harris has the side of working with DHEC and with our health partners, and then of course Ms. Goggins takes the lead with communication. But I suspect Dr. Jakes and Dr. Harris could incorporate their communication piece with their response. Dr. Jakes.
Thank you, Dr. Melton. So as Dr. Melton mentioned, this is something that we have had practice with. And so at each instance, when we do have someone who tests positive or reports an exposure, has symptoms, we do follow DHEC guidelines. We do initiate contact with DHEC. We do that in consultation with Dr. Harris's team when that regards an employee. And when it regards a student, then Dr. Harris simply takes the lead in making that contact. And we're asked several questions. We answer those questions. That helps determine what the level of contact may be. And then DHEC is specific about how to move forward in terms of any notification that may be necessary. Of course, wearing masks is a safeguard. Social distancing is a safeguard, but we ask those very specific questions. We get details about the specifics of exposure, and then we move forward. There have been instances where we've needed to send out communications that there could be a positive exposure, that someone has tested positive. At other times, we've determined that we did not have an exposure. So again, DHEC's guidelines do govern that process, and that happens both with the benefits team through the Office of Human Resources and with Dr. Harris and his team of healthcare providers.
And thank you, Dr. Jake. And I'll certainly just reiterate the fact that one of the silver linings, if I can use that phrase, in this whole process is that there is a very strong collaboration between departments and agencies and organizations in our community. Dr. Jakes has explained it well in terms of our making immediate contact once we are notified, be it staff or student, immediate contact with DHEC to begin the process of understanding what process we're going to follow. There is language, there are letters that we have already generated that help us to communicate with specific persons, teams of persons, parents, and community alike, if in fact there are cases that have been persons who have tested positive. I think another thing that I'd add to this too is that this is all specific to what happens. We've heard about athletics. We've heard about perhaps even in classrooms or in schools. But the same process follows suit as we talk about students on buses as well. I wanted to just kind of reiterate that. We will follow the same process there in terms of communicating accurately, efficiently, and timely to parents and to students who've all been exposed in one way or another with a positive person who's tested positive.
Can I ask a follow-on question with that? So let's suppose that, two scenarios. You have a student in a classroom who tests positive, or you have a teacher in a classroom that tests positive, and you're going to notify people, I'm assuming other students or parents of students in the class. But at what point do you tell that person, or at what point do the DHEC guidelines require that person quarantine or that teacher be quarantined? I mean, at what point are you interceding rather than just notifying, and what do those processes look like?
One of the things I heard Dr. Jackson mention, and I'll read it here to try to respond to that question, Mr. White, is that there are a series of questions that we have to ask rather quickly when we've been notified. And one of the questions that DHEC asked, the 2 or 3 in particular, says basically whether or not there was a mask being worn, whether or not they were in proximity of the potential person who's been exposed for more than 15 minutes or less. And then I think thirdly, the other essential question is whether or not they were socially distanced, whether or not they were within 6 feet or were they beyond the 6 feet parameters. Those are really guiding questions that help us to better understand how DHEC is going to suggest that we respond. So I think that's the best way I can respond to that, Mr. White.
I also think one of the struggles with that, and please correct me if I'm wrong, I don't want to provide misinformation, but in the past, if it were the flu outbreak at a specific school or a stomach virus that a certain percentage of students, DHEC has had some kind of hard and fast numbers, if this, then that. And my understanding is, unfortunately, they're not really providing that same level of specificity in this case.
Mr. Cates, if I may respond to that, Dr. Harris would like to add additional details that I may overlook. Flu season's still going to happen, strep season is still going to happen, all those other ailments that will strike as it does during any academic year, and then you add this, of course, on top of it. So Superintendent Spearman has been very inclusive of district superintendents throughout this process. We had a conference call the latter part of last week. It seems like days, I can't remember which day of the week it is with some of these. Last week, we had a call, and we know that DHEC is not going to give us as hard and fast data as we've had in the past. So much of this is going to be up to local decision-making processes to make sure that we're being responsive and we're reporting with our partners of DHEC. So when we start looking at absentee rates, whether it's staff, whether it's students, looking through the lens of what might it be? Might it be the cold? Might it be the flu? Might it be COVID-19? Whatever that may be, we've got to work very closely with our partners of DHEC. And because it will be a hybrid model, how many students may not physically be on campus and not engaged through a virtual platform? How many students may have been absent for the 3 consecutive days that you heard us talk about last time? So we've got to be very mindful of the engagement and also the attendance, whether the attendance is physical or whether the attendance is engaged through a virtual platform. Dr. Harris, anything that I'm...
Thank you. Ms. Hutchinson.
Thank you. Dr. Milton, how will we know which students have internet access?
Thank you, Ms. Hutchison. Ms. Garris alluded to that earlier, so I'm going to look to Ms. Garris, but also Director Holden, because Ms. Garris alluded to earlier the responses that we've had thus far of the families that completed our survey. Ms. Garris, that was, I don't remember what slide specifically. You may be able to speak from memory, but if you need the slide.
I don't. That's okay. The question was, how do we know? Was that what the
Yes.
question was, Ms. Hutchison? 2 ways. The main thing that we're using for the hotspots was the survey that we sent to parents that we asked if they had reliable internet service. And also I think what Dr. Are you doctor yet? Not yet. Not yet. Almost Dr. Holden will say is that we also put in registration gateway for our families, asking a very similar question about internet. So between the two, we're hoping to catch just about everyone. And then as I spoke at the last meeting, the other piece will be as kids return to school, our teachers and our school staff will be at the forefront of looking for those parents who maybe didn't respond to the survey or are new to our district. And so we'll capture those students at the beginning of school. Do you want to add to that?
That's correct. Essentially, the goal of the current reports is to ensure that we have that information broken down by school so that schools know exactly which students have the access. And the goal of having it in registration gateway was to provide us with that information as students prepared for the school year. Luckily, in having it in the 2 places, we've been able to collect that data a little bit more quickly and efficiently than we would have otherwise. So it's been good to have the question in 2 different places as we prepare for the school year.
Thank you. Dr. Melton, one question I had was, I think about my own children, especially as elementary age, is just the amount of screen time that's going to be involved, really in both the virtual and the 5 program and the hybrid program. Thinking about one of mine that I just don't know how well that would work. How are we going to manage just the sheer volume of screen time for our younger children?
Well, we still believe in developmental instruction, but we know that when students are taught via a virtual platform or whether through a hybrid model, Mr. Giuliano and team have done professional development and have more planned of how we can make sure that it's engaging instruction, but also sensitive to the fact of developmental preparation. Mr. Giuliano, anything specifically you'd like to add to that from a developmental lens? And knowing that younger elementary and primary age students versus the development through secondary, their skills, but also their attention span, and then the screen time issue?
Absolutely, and there will also be some times for breaks, for recess time, for other break times as well for students. So it's not going to be online for 50 straight minutes of instruction. It's going to be split up and broken up in different ways to allow students developmentally appropriate-wise, because the access or the ability for a kindergarten 5-year-old is different than the ability for a 12th grader to be able to maintain. But even at the same time, a 12th grader doesn't need to sit and listen to a 90-minute lecture either. So there is going to be definitely a chance for students to collaborate, work with others, work in groups, work independently, and then also get instruction from their teacher as well.
And the consistency of those expectations within scheduling constraints, Mr. Giuliano, that's within the professional development as far as guidelines for teachers to use to make sure that we are consistent among teachers, but also appropriate developmentally scheduled. Would anything you'd like to add to that?
Yes, a lot of the professional development that we're offering to teachers talks specifically about that. We've had work with all of our PD facilitators that talks about how to receive instruction through a digital virtual environment, and they're passing that information on to teachers and staff. And it's not just teachers as well, it's staff within the building that are going to support in a virtual environment too.
Thank you. Ms. Gardner.
I have a question about the surveys and the statistics that we received. I would assume that we actually haven't updated percentages of how many people responded. I mean, today is the 10th. I was wondering if we could have, if it's still consistent with the split that we saw for, and maybe if you have a breakdown for either cluster or grade level, not grade level, but, you know, high school, middle school. I mean, what's the breakout?
It is unusual to see Director Holden carrying a 3-ring binder.
It's got tabs, too. I'm ready.
No, it's not.
So you threw me off, Mr. Holden. So we're not looking for a report per school.
Got it.
But to answer Ms. Gardner,
Yep.
based upon the slideshow, and for everyone to know, we have to have board packet prepared to be released on time. So this timestamp of 2:30 p.m. on August 5th, the board understands that. But Mr. Holden, since the release of this information to the board to prepare for this evening, what information might you update consistent with what we've listed here?
We ended up with an 85% response rate. The survey ended up being sent to a total of 17,075 students, so slightly more students ended up receiving it as we reached out and did more with them for students who did not have email addresses in the system, and we were able to locate those students, or for new registrations that we ended up sending the survey to as they enrolled in our schools. So that's why the total number of surveys sent increased over that period of time. We also ended up with an 85% response rate, as I mentioned, and the final numbers for face-to-face and 5 ended up about the same. 64.1% of respondents selected face-to-face instruction, 33.3% selected 5 as their mode of instruction. The responses varied greatly depending on the school. We had some schools where there was a high percent of face-to-face instruction that exceeded what the district average was. We had schools where there was a lower participation in face-to-face instruction. So we don't have it broken out specifically by cluster. We have it broken out by school. But it does range. It is not a consistent number. The response rates, we were fortunate. We were pretty high. Every school was above a 75% response rate, which we were very happy with that. The highest response rate was a little above 90%. But the participation in face-to-face and participation in 5 vary significantly among the 21 different schools.
Mr. Holden, if I could interject there, when you monitored the data last Sunday evening, Mr. Holden started calling schools principals on Monday morning, and very quickly that metric increased because our families were responsive to our school administrative teams.
Yes, ma'am.
So tonight, I'd like to publicly thank all of our principals and assistant principals and their staff. Because of their direct involvement, we were able to accelerate. We were already at an average response rate, but because of them, it quickly increased. And I know that you were celebratory of them last Wednesday.
Correct.
We met with principals, but I'd like to make sure publicly our principals are, our appreciation is expressed for the public to hear because they are working with great coordination with our district office staff. Anything else, Mr. Holden?
No, nothing
Well,
else. Oh,
To answer Ms. Gardner's question, I'm sure you got more that,
I have plenty of pages. I'm ready.
Ms. Gardner.
Well, I guess the question is, what do we anticipate with the 15% that didn't respond? Do you think that's just bad email addresses, or people have have moved out or have decided to homeschool, or we anticipate that's 15% that doesn't have internet access, or?
No, with any survey we do, there's a percentage of parents who don't respond. When we do placement forms in the spring for parents, we get some who we don't get back. Some of those we've heard from today who simply just hadn't completed the survey.
Right.
And we're working on procedures for how to address those, because we're also trying to schedule and staff 5 and ensure that we're set up and running with what we have there. There was a minimal number with no email address, no valid email address. So there's a variety of reasons why someone might not have responded. Some that emailed today simply said they just hadn't done it yet, and we're wondering if they could do it now.
Right.
So we're working on the procedures for how we address those types of concerns.
And what about the numbers for the teachers? It sounded like that response was pretty low at the time. Have you've had more responses from teachers since the 5th?
Let me complete the previous question, then I'll tackle that one, engage Dr. Jakes with that. In addition to what Mr. Holden's described, to make sure that we're reaching the students that may not have answered, whether it's a faulty email address or changed email address, whether it is we're on vacation or we're in a situation that our family's been stricken by health, those are variables that we understand are real. We're trying to make sure that individualized personal phone calls are occurring, use of the U.S. mail. We've been reached out to. Dr. Harris has received correspondence from local law enforcement asking what they could do to be of assistance. Dr. Harris has included our social workers. So now becomes more of the individualized, more personal outreach visitation that we're trying to coordinate with. We do know that we've had a percentage of families that moved the way they do any other year. We do know that we have some families that are considering other options of potential different options of leaving School District 5 for another, as we would any other year. So we're waiting to make sure that they're requesting records to be released. So that may be a piece of information that's also influencing our data reporting as well.
The 2 other pieces are influencing as well. We did include the withdrawal option. The numbers there were
Right.
no more inconsistent than what we'd have with any other school year. We also had some families who submitted conflicting responses. In some cases, that was because they changed their mind during the window.
Yeah.
In some cases, because there was a miscommunication from the folks who were submitting it on that side of things too. So we have a variety of those situations that occurred, and we're working to address those. Again, our schools have been a great asset to the district there in terms of reaching out to those individual parents, speaking with them about what their preferences were when we noted a conflicting response, where we had multiple responses from a student, but they weren't the same.
Okay, so I'm just glad to know that you're doing something. We're not going to wait till day 1 when
Oh,
school
no, ma'am.
starts
No,
to figure
ma'am.
out what happened to that 15%.
No,
Okay.
no, ma'am. And I commend Mr. Wiseman and his team. They continue to be visible in our communities and delivering things to families as appropriate. And of course, our nutrition summer programs continue as well. So I think your second question, I'm going to ask Dr. Jakes to become involved with, was regarding the response rate of those staff members who may not have replied to the survey. We know that teachers are 190-day contract employees, so they may not be as engaged during the summer months as they would be the typical academic year. So Dr. Jakes, for their engagement to make sure that we've reached a percentage of our satisfaction, talk a little bit about what we're doing to make sure that our staff has the opportunity to be engaged with the process and have a chance to inform you and their direct supervisors of their needs for the coming academic year.
Sure. So this was a little different for teachers because rather than a traditional survey for employees and teachers, this was actually sent as a communication for a formal request for a virtual work assignment. So this was not, employees were not required to make such a request. It was simply an effort to get in touch with each employee to let them know that such a process exists and to give them an opportunity to follow up individually with the benefits office. So each time someone responded that they may need an accommodation, it reminded them to use that link to communicate with the Office of Benefits so that we could follow up formally with that medical request. So in this particular case, when we look at the numbers, we are satisfied that employees have requested those accommodations as needed, but this is not the type of survey where we would look for 100% response. This is simply that avenue, similar to a transfer request window that we would establish each year. We don't expect every employee to request a transfer, but we do ensure that each employee receives the opportunity. So we do believe that this has given us very significant data in terms of what those requests may be. However, we are still continuing to accept those requests for accommodations, and we do know that new needs may arise.
And Dr. Jakes, Mr. Cates, if I may, there may be employees that have scheduled appointments coming up. So they may be awaiting that appointment before they follow up with our benefits office. So Dr. Jakes and her team continue to be personalized. I continue to be impressed the number of employees that send emails to Dr. Jakes and sometimes copy me or send shout outs to me to celebrate what our benefits office is doing. And one employee actually wrote, I didn't even know what my benefits were until I called Karen Carmichael. So it's a great way that we're actually educating some of our seasoned employees that may not have been directly involved with updating some of their information. This has given us the opportunity to be personal and to make sure that they have a chance for their individual questions to be heard in a private, confidential setting.
All right, I'm going to go to Ms. Hammond and Mr. Gant, and then Mr. Lovelace. And then I have Ms. Hutchison. So I see all these hands, and I promise I will get back down that way as well. I'm going to go this way first.
Thank you,
Ms.
Mr.
Hammond.
Cates. I do think this is also very important. I have a question that's really for students, and it has to do with, can we allow flexible time when they have assignments? This could work either whether it's the hybrid, because sometimes they will be virtual, and then are also for 5. But if there's an assignment that a teacher is giving, and it's to be completed during the class, there's a such thing that a teacher taught me, and I know it too as a teacher. It's called Zoom fatigue. And if you stayed on a computer a long time, Dr. Milton, you know this,
Yes, ma'am.
they sometimes just get zoned out. Even adults can. So I was hoping there's some flexibility, and it may be that you're going to tell me it's left with the teacher, you know, that's in charge of her class. But I do think it's an important question for students and parents. In case that student has been there working diligently, maybe not working diligently, but they're going to get that assignment in, will it still be counted, and there'll be flexibility to when the assignment is actually completed?
I may look to Mr. Giuliano to see if there's something I overlooked for your response, Ms. Hammond. As if we were in a traditional academic year where students were in the classroom, I would encourage parents and students to be as vocal and advocates for themselves. Mr. Giuliano and team have developed some developmental guidelines that we feel are appropriate, but we know that those guidelines are parameters. So you know your child best. We would encourage you to reach out to that teacher to make sure that teacher knows. If there is difficulty to completing assignment to reach that date that the assignment's due, let our staff know that. Of course, there are some timelines that teachers have to meet to keep on schedule for quarterly grade reporting, for example. So there may be some times that we could not extend because of the reports of grades that need to be entered into the system so that we can have our interims ready and our quarterly grades that are due. So sometimes, depending on the academic year, and you certainly understand this, you don't have as much flexibility as you would have had 2 weeks before that. I would also encourage families, especially those that may have IEPs and 504s, be in touch with your team, your special education team, because those may be students who are having difficulties. Those students that may have taken a true summer break and not have had the exposure to screen time the way they did back in March and April, we may need to build that stamina back up in our students to get their skills back in the habit of being used. Mr. G, what might I have forgotten that you'd like to add?
You said that perfectly, Dr. Milton, and Ms. Hammond, just as you mentioned too, it's going to be up to that individual teacher to work with students as well. So communication is key, two-way communication.
Well, and I appreciate the word flexibility, because I think that every teacher does feel in control of their class and know their kid best.
Yes, ma'am.
And the parent. And I really appreciate that. And so I had one other, but there's so many, I want to be fair and let somebody else, you go to somebody else.
Mr. Gant.
Thank you, Mr. Cates. I wanted to follow up on the question Ms. Hutchison had a little while ago, and hopefully I'm not taking away one she wanted to follow with. But we talked about a little while ago hotspots and how a family might qualify for some hotspot assistance with whatever funding. And it daunts me to think you've got to be below the 250% 50% below the poverty level to maybe qualify. And I know that we know in District 5, people think of this district as we're extremely fortunate district, but we're a piece of America. We have a little bit of everything. And we have homeless students. We have many parents that struggle very hard to provide. But I'm very concerned about one of the opt-out forms that I've seen is an on-site opt-out form that you have to sign if your child's going to do virtual education. And I hope and pray that a parent wouldn't sign this unknowingly, but there's a requirement in here, possibly, that a parent or the student would be responsible for a lot of equipment and supplies necessary to do their schoolwork. And I'm concerned about, number one, I heard a question about surveys that Ms. Gardner gave. We're not going to get all these surveys back. We're not going to hear from all our students probably till school starts, either virtually or the hybrid, and then hopefully on the 8th of October when we start back and see them all face to face. I'm being very optimistic. I hope that happens. I guess my question, and it's more of a statement, how are we going to follow up the students and make sure, and I heard social services a little while ago, I know we got a great staff that looks into all these different pieces, but how are we going to know the students that are out there that need assistance? And I know the CARES Act is going to do some things for us, but I know that we have a reserve fund. And I think there are funds that we may have to expend that'll be a one-time expenditure that we may have to help some of these students. So I just wanted to put that out there. I know that a lot of these things will go hand in hand, but this form itself, if people aren't reading that carefully or just trying to get something off their plate, or if I'm a homeless child and I'm living somewhere with a friend, I may sign that and go right on. Nobody will really know until I don't turn in work or whatever. So I'm just making the statement, as a school district, I want us to follow up. I want us to do as much as we can to identify students that need help. Some of them might live in a home right here in our district. The parents just can't provide this, and we need to be able to step up and help. We're doing a lot of help for all of our students with all the technology and supplies that we do. That's more of a statement than it is a question, but if anybody's already addressed that, knowing we won't get all these back, I'd be glad to hear, Dr. Milton, what our plan is to address some of those people that may sign off on a form that won't be able to deliver, or their child will be left without the supplies or anything they need to complete. So thank you very much.
I think you've addressed the hotspot. I believe the form may be coming in one of the policies we look at hopefully shortly. But we do recognize that there are folks with great needs, and we do have a plan to address those. So thank you for that, Mr. Ganton. We'll talk more about that specific form as we go into our policy section. Mr. Lovelace.
Yes, this is kind of a follow-up to that, but as a caveat, everybody ought to realize that a hotspot is not a substitute for permanent internet, and even in Timberlake, where I live, was very spotty with permanent internet. And I know the last time my wife was trying to listen to the board meeting, and it went off 3 times in our neighborhood. And I noticed, I think I read somewhere, and correct me if I'm wrong, but we're in virtual learning, that would be either 5 or hybrid, that the classes would not be recorded, that you would basically, if you missed the class, that it would not be repeated. And I have concern for that because of where we live. It's so spotty, and I wanted to bring that to your attention. Am I correct in my assumption anyway? Did I read that?
Well, I'm going to look to Mr. Giuliano and Ms. Garris, because we know that there's once you record and store things, that's going to affect our capabilities. So I'm going to look to Mr. Giuliano, since he and Ms. Garris have been involved with that and reporting to the state our plan. Mr. G.
Back to kind of what Ms. Hammond was talking about earlier with the flexibility, we're encouraging all teachers to work with their students in a flexible manner. We know that there's going to be internet issues at some times. that could, a storm could even knock out internet or whatever reason may knock it out. So that's simple communication between the student and the teacher so they can work out a plan with that. Some lessons are going to be recorded, some lessons are not going to be recorded, but at the same time, no student's going to be punished because their internet was not working.
All right, Ms. Hutchinson.
Thank you. I had a question about the metrics that Dr. Harris had mentioned. I don't think it was, I can't remember if it was last meeting or the meeting before. I can't seem to find the description of the metrics that he is monitoring. I believe it's a certain measurement for over 2 weeks' time. I was wondering if we have that on our webpage. Maybe it's in the board minutes, but I just couldn't find it. But my question is, well, that was one question, but to follow up, I know that the CDC and I think DHEC has said that if we reach 10% positive rate, and that is, we're in the red zone. And that would mean that we should not have face-to-face. Maybe the metrics that Dr. Harris was talking about were a little bit more detailed than that hard and fast rule. But if we are looking at the metrics, are we looking at just the zip codes and determining that? Are we looking at the 2 counties, since, you know, we're really all connected? And are we prepared come, you know, a few days before September 8th to say our metrics don't look good and we don't feel like it's safe to initiate the hybrid policy because we're not ready to expose students and teachers and staff? Are we prepared to say that everyone is virtual until the numbers get better?
I'm going to ask Dr. Harris, Ms. Hutchison, to make his way to the microphone. We did discuss that last time of him monitoring zip codes. Of course, today DHEC announced 718 new cases in South Carolina, which is the lowest number in 8 weeks, according to the report that we had today. Dr. Harris, talk a little bit about what you're doing to monitor the county monitoring and the partnerships that we're using to have that information.
Thank you. Great question. You know, we are monitoring not only zip codes, 6 in particular, but we're also monitoring by county as well. And we're looking at that on a very regular and routine basis. As you've indicated, as of today, it does appear that there is a slight decrease in the number of cases that we've seen in prior weeks. We continue to maintain contact and communication with, as you mentioned, DHEC, as well as our partners at the local hospitals, Prisma in particular, Lexington Medical as well, to kind of stay in touch and in tune with what they're seeing and what they are suggesting and advising. I had notably two different, and for different reasons, contacts and communications with Prisma executive senior vice presidents on last week just alone, just talking about school and talking about what's happening and what they're seeing and really putting all that together and tying into what we would suggest and recommend here in School District 5. So, Ms. Hutchinson, to answer your question, the metric is as inclusive as we can, as inclusive as as we know it to be in terms of the entities, the organizations, and the people that we can reach out to that can feed us information to help us make the best and the most appropriate decisions here in the district. And again, that does include all zip codes and counties, as well as looking at local municipalities as well. I mean, we want to hear what they're saying and what they're seeing so that we can make some informed decisions here in School District 5.
Ms. Hutchison, I've said of the previous 2 reports, comparing this with the weather incident, that we may have to make announcements with a very short turnaround depending on what we see or what happens. That, of course, isn't what we're working towards. The amount of work that goes towards a hybrid planning is much more intensive than it would be had we had a normal academic year because of the scheduling components and then, of course, facility needs. We may have to close a classroom, we may have to close a school, we may have to close a district, just depending on the numbers and what will happen with the cases that may occur. Dr. Jakes, Dr. Harris will be involved with that, of course. We would communicate through Ms. Goggins, but we would make sure that we were inclusive of health partners and, of course, DHEC to make sure that we had guidance and support from them and their experience to make sure that we are making thoughtful decisions with responsibility of the wellness of our students and our staff and, of course, our community.
Thank you. Ms. Hutchinson, you go.
Mr. Gates, I want to follow up with Dr. Milton. I think I appreciate your answering Dr. Harris's. I think it's really important for our public to hear what you just said. Just to be reminded, this is, I believe you use fluid, and this is a very fluid situation. So as you mentioned, what they're expecting may stop. And so maybe be prepared for the unexpected is the answer. And then Dr. Harris, if you could let us know, I'm pretty sure it was a presentation you made, or maybe it was a handout, that talked about the different metrics. Could you let us, the board, know where to find that? Does not have to be tonight, but maybe the next several days.
Ms. Hutchinson, that was actually, I think, in the first update Dr. Melton did, and it's the Accelerate Ed map, I believe, is what you're referring to, that shows low, medium, and high incidence rate. Is that the one you're speaking of?
No,
Just
it
trying
was
to make
something
sure
where
we know.
Dr. Harris. We don't have to go into it now, but I can speak
Yeah,
to
if you
Dr.
can
Harris.
email Dr. Melton a little more detail on that, I'm sure that can be tracked down. I know the Accelerate Ed did give some guidance, and however, that's kind of been reframed as recommendations and not necessarily guidance. I also know the governor today has asked DHEC to put some kind of measure in place to track incidences at the school and the district level. So some of that is changing even as we speak. So thank you. I am very mindful of the time we have. I don't want to limit debate, but if, some of our questions, I believe, have been asked and answered in other presentations, and there are other avenues. But Mr. White.
I'll make it real quick. Two things. The first is, it sounds like there's a lot of reliance upon DHEC with the issues. And is DHEC, I mean, do they have the staff to be available? I'm assuming districts all over the state will be calling DHEC. I mean, has there been any dedication and increase in people that, because I'm sure we're not the only district that's contacting DHEC.
I don't know if they have. I can say that we're fortunate to have partnerships that when Dr. Harris or Nurse Cindy, as we call her, calls, we are fortunate to have responses. We also work in conjunction with the department, who is a partner of DHEC. So it depends on which route we need to go, but I don't know about the DHEC staffing.
The second question I had, and goes back to these hot spots, but I saw something in an email where I think it was a teacher was suggesting there was only 39 students that actually, do y'all have a rough count of how many students might be dealing with that issue of not having internet access?
Yes, sir, we do. And Ms. Garris, if you'll come to the microphone, that was a part of Ms. Garris's work because she's been collecting data to make sure that as we make requests of the department to use allocated funds that we can have informed decisions. Ms. Garris.
So based on the survey that I referred to earlier, I believe the count was 293 students. Now remember, hotspots go per family, so that wouldn't necessarily be 293 hotspots because there might be 3 kids in the family and they're eligible for 1 hotspot. So we're working on consolidating that right now based on addresses and so forth, but that was the student count that we had based on the survey. So as we dig down now to who those families are, where they live, and making sure the qualifications are, that I'm estimating that's probably going to be a rough, maybe a little bit lower number, but again, we haven't accounted for some of those that didn't respond to the survey that will come at the beginning. So we ordered more hotspots than we currently needed because they knew, the state knew when we ordered them, we were estimating. So we were able to order, I think we ordered 600 was the total number. So we've got them as the families qualify. So we haven't received them yet. I haven't received confirmation we'll get all 600 we ordered. But we're pretty confident that we'll be able to cover the needs that we have of those families that qualify.
And so the follow-on question to that is, I mean, I've heard, I guess every meeting we've been here, that people expressing concern we didn't spend CARES Act money on hotspots, but it sounds like y'all have another source, and there's not an issue of paying for hotspots. And then the other question is, I mean, correct me if I'm wrong, but I haven't heard anybody say that we don't have money to buy hotspots. We have a grant or something from the State Department of Education. But then the other part of that, what was the date that we had a grant to pay the service? Was that this December, or?
It has to be expended by December of 2020. Yes, sir.
So then there'll be a need to be
The
a source of
presentation you did
funds. If
earlier.
we're still in a virtual mode, there'll need to be another source of funds to pay for service.
Of course, we can't predict whether there'll be continuation at the state level or not, and we can't predict whether there'll be additional federal funds to draw down into states. But based upon the information we have currently, Ms. Garris, December 2020.
December 30th of 2020, that's correct.
But that's not a huge amount of money for service for 200 and something households. I mean, that's not like going to break our budget by any means, is it? I'm suggesting that, I mean, just based on what I know of our budget, it doesn't sound like a huge amount of money.
Well, I think if we added a lot of not a huge amount of money, which may be subjective, how much Mr. Richardson can make sure we maintain the priorities would be if we didn't have additional funds through grants or federal funds or state funds. It then becomes a priority of within this allocation of the funds we have at our discretion, what do we prioritize, so then what do we remove? Because once we get this budget, depending on whether the budget's passed or not, Mr. Richardson then starts executing the plan, and then any variables that change after that point, we would have to work within those parameters.
But we're not going to be in a situation where we can't pay for service, is what I'm saying.
Well, this service that's through December 2020 is actually paid through the Act 142.
Now, I'm assuming if we continue virtual past December 30, 2020, I just don't hear any concerns about our ability to find a way to pay. That's the question I'm asking.
I don't know that I can say that I'm not concerned, because I can't predict, not that I have control issues, but if I were to have issues with trying to make sure we're properly prepared. Mr. Wiseman, be careful, don't fall out of the chair over there. We've got to be prepared. If this pandemic has taught us anything, we've got to be prepared for the extremes. The extremes that we could potentially have to have an academic year virtually or be back on site for 5 days for those that choose to be. So we've got to make sure whether we're using state or federal funds through a grant or allocations, whatever that may be, that we could use it. If we get to the point, Mr. White, that we feel like we have disengaged population, and to me, one student is disconnected. To me, there's not a percentage of 5 or 15%. If we've got one family not connected, then we've got to find a way to engage with that family with every resource that we can garner to do that. So we would continue to update the board, and if we saw that became a monetary issue that we needed to seek your support for expending funds, we would bring it back to this board. I feel with the current funds available to us, we have a plan through December 30th of 2020 that we can successfully implement what we have brought forth to you for the third time this evening with reports. Ms. Garris, I would not want to put you in that position, but based on your comfort level, anything that you'd like to add from your supervision of our implementation of virtual education?
I think the other piece that we've not really talked about was there is a statewide initiative to expand broadband all across the state, and so we do have pockets where it's difficult to get service of any kind. And so I will add that that's another thing that's a state initiative, and so one of the things that we've done with our State Department connection, if you'd call it, that's worked up with hotspots, is identifying some of the families where they don't have internet because cable or whatever fiber doesn't go down their road. And so there's another piece to there's the economic, not being able to afford internet, but there's also the availability in some of our remote areas. And so I do want to share that is something that you can read about that quite often. It's being pushed statewide. We are still very fortunate, and I agree, one student disconnected is something we're going to work for to help them. But that other piece is also in play. And so I would encourage anyone that, is involved in that or hears that we really do want to advocate that for all of our families.
And Ms. Garris, if I may echo, in your presentation earlier, you talked about the confirmed partners that you and your team have sought and gotten commitment from. If there are any in our community that are interested, or there are people in this room that are connected with those that are interested, talk with us a little bit about what they should do to reach out to you, to do them become a new partner, to make sure we're reaching a broader availability and access in our community.
Absolutely. If there are businesses that, or somebody that that has that Wi-Fi that could be available to our students, if you'll contact the district office, they can connect you with our technology department, and we'll route you to the right person. We would love to know that, and we will keep our website updated with all of that information and work with our communications team as we get closer to school to let our families know about those opportunities. Because as I said, sometimes you have internet and it goes out, and so knowing that can help everyone.
All right, thank you. Ms. Hammond.
Yes, I would like to know, if you can give me the number, how many teachers left their homeschool for 5, and is it still their option to return to their homeschool if and when all this is back to the 5x5?
I'll ask Dr. Jakes to weigh in on that. We are in the process. Obviously, the survey is completed. We are closing, although it's still available for those families who didn't participate. So staffing is always fluid until approximately the 10th day of school is when we settle down. We typically move people around up into the 10th day and then we settle. Dr. Jakes, based upon where we are currently, what could you share with the board at this point of our process?
Sure. So we are at the point today when we presented our last timeline. Today was the day that we were to share with principals what those teacher requests were within the building so that each principal has a sense of where we are in terms of that staffing. We're actually in the midst of making those assignments and developing those schedules with district office personnel as well as school personnel. So at this point, we do not have that information in stone. While we are working on it, we are making every effort to work with teachers to involve principals in those conversations as much as possible. And at this point, the program that we have for 5 does not, or rather I'll say it does allow most teachers to remain where they are to teach through their current location, especially at the elementary level. But as we continue to look at middle, intermediate, and high school schedules, we have to make those designations in the days to come. And as we communicate that, we'll also be very sensitive about that question about where am I assigned. While we do all work for the school district, we know that we do have identities within our school buildings. We do have relationships with our principals. We know that for evaluation purposes and a number of other areas, there is comfort in working with your home school and with your home principal. So we will move forward with sensitivity. We simply don't have that in stone yet.
Does that mean that you will try to accommodate a teacher's wish? I mean, I keep thinking about just how the numbers work out, Dr. Jakes, and I know that's that's why you're so smart and you're going to figure it all out. But I was thinking, say, the actual course a teacher teaches, at a given school, but they're going to do virtual. I just wondered if it works out for them to have the same number of teachers that teach a certain course, and they're virtual, as opposed to those that are going to teach it, in hybrid.
There are going to be times that the numbers do work very well. There will be other exceptions that we'll have to broach, but I will reiterate the comment that you made. We are going to work with teachers, and we are going to be very professional, communicate that, and of course, we're going to value our teachers and make sure that we are making decisions in the best interest of students and our employees.
Thank you, because, it is stressful for you guys that have had to put this together, and it's stressful for teachers and parents, and especially students. Thank you.
Michael, I got one more.
All right, Mr. White.
In this question this question I've seen before, but somebody just texted this to me, so I'd like to get the answer out there. And it goes back to the CARES Act, that we got $1.6 million, and we had the discussion of where we're funding hotspots. And and I think the answer has been given that we spent that money on salaries for school bus drivers and cafeteria workers when it was, and the question here is, wasn't that money supposed to be for COVID issues? Can you clarify where that money went, why you prioritized it the way you did, and the fact that we're still able to, you know, assuming we're not, and my earlier question was making sure that we're not leaving needs we can't meet somehow, but I think that's a question I've seen several times. I just assume we get the answer out here.
Thank you for the opportunity, Ms. Richardson. I'll ask if you'll make your way to the podium for that. As I said earlier, the funds that we have expended have been approved by the State Department, so we are in compliance with how we've allocated funds and how we've routed them towards the needs that we've had. Of course, during the closure, we have, I have omitted the most recent number. I'm looking at Mr. Beanville. I'm sure he could shout out the number that we have fed as far as our meals and then the transportation routes, but I didn't come prepared for that this evening. But Ms. Richardson, talk a little bit about how we were able to use those funds and the rationale we put towards that was inclusive of all executive staff based upon the discussions we had, the needs that we've identified.
Sure, and it's a great question. There are obviously several pots of money with the CARES Act funding. The first part we were talking about were the ESSER funds. I think that's what everybody's referring to. The approximately $1.6 million that we, excuse me, that we applied for, and just to let you know, approximately $50,000 of that has been set aside that we do have to work with some private schools in our district to provide some services, and we've reached out to them. I don't know where we are in that process, but there are approximately, there are 12 different areas that money could be spent on. And what we did was, what our thinking was, is we use, and I'll read it to you. It says, other activities that are necessary to maintain the operation and continuity of services in local education agencies and to continue to employ existing staff of the local education agency. What we felt like is because we were out for so long, we still were paying those employees, that we would use these funds to help pay and offset their salaries so that we could set aside, those resources are still in our general fund. We'll be able to carry those forward. Our thought process was to put ourselves in the best position we could fiscally for this current year in order to hopefully weather the storm. Everything that I'm still hearing, it's going to be worse than the Great Recession. So we're planning for the worst and hoping for the best, but that's primarily what we did with those funds, and it'll be reflected in our audit where we spent those funds. And they were spent last fiscal year prior to June 30th.
Right. Thank you. Ms. Gardner.
I just have a question because I have, as a parent and as a board member, I get many questions daily about what's going on, and specific questions like, is our juniors going to be taking the SAT or the ACT, because usually we get a choice, but now they're told that they're not going to get a choice. Are the virtual students going to be able to do band? I mean, what about my special ed child who gets all of their services through the school? Now they're going to be going to school 2 days a week. How are they going to get their services? I mean, millions of questions, basically, it feels like. And I have probably 5,000 of the hits that you're getting on the website are me trolling it to see what the answers are to some of these questions. Do you recommend, I mean, do we have a plan to upload everybody's questions and answers on the FAQ? Or does every parent, is that the most efficient way to do it, for us to have every parent use the reentry at lexrich.org? Did I do that right? lexrich5.org. What's the best pathway? Because I don't have these answers.
Well, first, I celebrate they're asking you, because obviously you have a relationship with them. I would encourage anyone that has questions to reach out to the appropriate staff members. The reentry address, as Ms. Goggins referenced earlier, I see you're in the back of the room, is still operational. Many of our principals and school administrative teams are taking on the lead so that as families email us specific questions, whether it's about an IEP, whether it's about a schedule, we want to connect that family not with reentry, because that's not a generic question. Mm-hmm. Something about transportation that could benefit the good of the group, we want to add to the FAQ. Something that's personal for your student, your child, we want to connect with that guidance counselor you heard Mr. Giuliano reference earlier, that school administrative team, so that you can get the accurate information rather than a summary of what you could expect when you would reach out to someone. We know that families have relationships with our schools, so I would encourage our families to call the front office and let that front office staff route you. If you all as board members receive those questions, encourage that family to contact the school, encourage that family to contact the appropriate person, that guidance director or the guidance counselor, depending on which level it is. Secondary directors, elementary is more of a guidance counselor, or the school administration, because those are going to answer questions faster. Those things that are posted on social media, Ms. Goggins and her team, as of last week, closed out all the reentry questions that had been posed through the official process. Of course, that may have changed as soon as she sent the email that all questions had been answered, to include multiple parts. So with that, that's going to continue to be active. But the closer we get to the start of the year, the more individualized we need this information to be, which is why we encourage parents to reach out to the school administration, the school office, rather than seeking generic information. Things that are posted on social media, Ms. Goggins and her team respond. Sometimes it's individual outreach to answer that question. Sometimes there's a response on social media, but we have parameters as to how we engage with social media. So Ms. Goggins and her team keep us in compliance with board policies, but they also keep us in compliance with School Boards Association expectations to keep us out of legal implications. So you saw earlier the metrics that Ms. Goggins presented. Her team is to be commended for their engagement. They have certainly spiked our following. You get information with accuracy when you reach out to us. And by reaching out to us, we can connect you with the right people, and you get the answers that you need.
Good, thank you. Dr. Milton, does that by chance conclude the superintendent's report?
Yes, sir, it does. Thank you.
I have a remark I'd like to, or it's really a statement on the reentry plan, so I think it'd be a time to read it. And I'd like it to,
is it a question?
No, it's a statement. I'd like to be, but it's about the reentry plan. It's short.
Yes, ma'am.
Yes, thank you. I certainly appreciate the hard work of Dr. Milton's staff, and I am not opposed to the reentry plan. I support it. What I am opposed to is the process by which the plan was reached in relation to the board's role and the board's opportunity for input in the beginning. There was no discussion with the entire board, nor any data from teachers and parents provided to us prior to the decision being made and the presentation we saw was given to the public. This has been my frustration in the past. It's my frustration tonight. The board leadership excludes certain members from decision process. Respectfully submitted. Thank you.
Ms. Hammond, that would have been more appropriate for you to add to the record, and I think there is a process for that. I can assure you that the board leadership has excluded no member, and that you are privileged to the same exact information and in the same timely manner that I am. Mr. Gant, did you have one more question? I just want to make sure I didn't miss that. And I think you're muted, Mr. Gant. If you can, Mr. Gant, you are muted. If you'll just, I'll give you a, thank you.
Mr. Cates, I didn't have a question, and I thank you for recognizing me for whatever reason, but I appreciate your defense of the board leadership. I think Ms. Hammond's statement is appropriate for Ms. Hammond and people that think they're excluded from the board leadership decisions, but I can assure you, you just made an accurate statement, Mr. Cates. We were privy to no additional information, Ms. Hammond, than you were. And I don't appreciate those assumptions and those statements that you most use it to just say, but you've put that on the record. Mr. Cates, I appreciate your defense of the board leadership, so I thank you very much.
All right.